Okay, so we're here with, this is me, Dr. Smith of Chiropractic Whole Health, and I am talking today with Jen Ragazzo. She is a holistic functional medicine health coach, and we have been sort of partnering together since the beginning of 2017, trying to help patients dig deeper, trying to help patients with more complicated problems, and trying to help patients who have really want to make a commitment to getting and staying healthier and finding the root causes of their problems. So one question I get a lot from my patients is, what is this health coach? What's this functional medicine health coach? What does she do, and why would I need help with her?
Right. Absolutely. So like you've just explained what I do a little bit, but I'll go into a little bit more detail. So as a functional medicine health coach, what I do with my clients is I really look at each individual client as being a bio-individual, as we all are. And they come to me and I often say to them, I say, we're all like a puzzle, right? And some of us are 100-piece puzzle and some of us are a 5,000-piece puzzle, and we need to dump out the pieces of everyone's puzzle and look and start making connections to figure out like what are the root causes of what's going on in their body, because my goal is to help educate people to optimize their health. Like I educate them to be able to take action in their health. And sometimes that's making dietary changes, lifestyle changes, really looking at stress in their life. You and I both, we do functional medicine lab analysis. That's one of the first things that I look at, because I think it's really important to be able to pinpoint, what do we need to maximize in the body? Maybe that's some nutrients that person is deficient in. I do a really extensive inventory when I start working with people on everything, including sleep. Do they need to maximize their sleep? Are they not having enough joy in their life or self-care? So I'm here, my job as a coach is to walk alongside of someone and guide them and guide them with education, empower them with knowledge. And I use my knowledge and my education in order to do that, like really narrow it down for someone. And I've been able to, in doing that, I've been able to really help people turn around a lot of their dis-ease in the body.
Right. And when you think of a coach, like some people think, well, why do I need a coach? I could do that myself. But if it's a sport, why do you have a coach? Maybe you play soccer. You know how to play soccer. You know what to do at practice. But a coach is someone who's got a little bit more knowledge and a little bit more experience than you do. And they also have a plan for how to do it. And they have the time to devote to giving you guidance. So that's what I tell my patients is, you really, if you're going to hire Jen, if you're going to have her help you, she's there to give you guidance, support, encouragement, accountability.
Yes.
And then she has time to research things, right, that maybe you don't. And she has expertise that you don't through her training and holistic health coaching. And then all the things you learn, and I learn things from you all the time because this is your field.
Yeah.
I'm trying to split my time between chiropractic and this. So that's really what people are getting, is that expertise.
Oh, absolutely.
So what sort of led you down this path to go into functional medicine and go into health coaching? How did you get here?
Great. I had gone to college for education. My master's degree is in education. I was a teacher. And then when I had my children, I took a break from teaching for a while, but I had started opening myself up to the world of more alternative healing and holistic healing in my mid-20s. when I was suffering from endometriosis really badly. And then when my husband and I wanted to start a family, we were unable to at first, and I had to do in vitro fertilization. And honestly, that was the very first time in my life that anyone ever paused to have a conversation with me about the food that I ate and the effect that it had on my body. It was my second round of in vitro fertilization, and a nurse took the time to talk to me about that. And I had never even thought about organic food ever. I mean, and what eating non-organic food may possibly be doing to my body, or consuming things like too much soy. So that just opened the floodgates for me. I was very passionate prior to that about fitness. I was a fitness instructor as well. I did obsessed with exercise. So that started the wheels turning, like you have shared with me in the past too, having a family, changing. But I had a lot of my own health issues, from endometriosis to chronic migraines and thyroid disease and anxiety and depression. And I was put on a medication for every single one of them. And I hit a place, everyone, and you know a little bit about that because you've been my chiropractor for over a decade. So even when I came to you, I was still on a handful of medications just because I was put on them in my 20s, and
Sure.
I didn't know what were my alternatives. I didn't know anything about food sensitivities affecting my body, leaky gut, all of those things. So when I decided that it was time for me I was ready to go back to work in a sense. I went back to school. I didn't feel called to go to teaching. I wanted to use my ability to educate people and my passion for helping people and sharing with them alternatives in the health and wellness space. So I went to school initially at the School of Integrative Nutrition, and that opened up this world for me in health coaching. But I wanted more. And I found a lot of my own healing and my own ability to be able to optimize my health. I found it with functional medicine, and which looks at the interconnectedness of the body. So then I continued on with my education at the School of Applied Functional Medicine, which I'm actually still right now doing another master's level with the program, just because you can just keep going deeper and deeper and deeper into the understanding of the human body. But I love it. And I've been able to really help so many different people find relief.
I had forgotten the part about you, that you were a teacher previously. So now I see how even that expertise plays into being able to help people because of your experience with teaching, not just your knowledge of functional medicine and health coaching. So one thing that was so helpful about us partnering was the amount of time that it takes with patients who want functional medicine help. I didn't have that time really to devote to patients who needed that help. So I was so glad to have you as a resource to be able to send patients to, because you have that time and expertise, and that's what patients are getting really, is a lot of your time to walk alongside them, to keep them accountable, to encourage them as an expert.
Yeah. Oh, I love it. I mean, I tell people all the time, I tell my clients, like, because they'll be amazed that I know certain things, or that I've been able to recommend, whether it be, a food item, or, a really great book, or whatever that is. And they're like, how do you know all of this? And I just say to them, I'm like, this is my jam. I mean, this is what I do. This is the way God's created me, my mind, my passion. And not everybody lays in bed at night researching these things and thinking about these things, but that's just the way I am. And I mean, even though I've only been health coaching for a few years, I feel like my entire life I've been preparing to do what I'm doing now. And I love it. I love helping people uncrack the code, or crack the code, I should say, with their health, and put different puzzle pieces together and help them find relief that they're seeking. We've together, you and I, because I send a lot of my clients, if they're local to me, because I do work with people who are further away over the phone as well. But if they're local to me, to be able to send them to you because you understand the benefit of looking at labs, like some of the labs that you and I look at are much deeper and much more extensive than they would get from a primary care physician. And
Right.
so when I send them and you and I see things, like we see things that nobody else has seen, and then we can address that. And all of a sudden our patients are finding immense relief. I mean, people who've been able to really just go from having absolutely no energy, feeling lethargic and inflamed and overweight, to having buoyancy and vibrancy back in their life. And insulin resistance, that's something I think you and I have seen over and over and over and over again, right? Like, how many labs did we get back? We're like, insulin resistance or Hashimoto's, I mean, it's really fun. It's really fun. And I feel like, God has wired us both to be able to serve people in this way. And it's been fun. So yeah, I mean, my job, I'm walking by someone, and we can't do everything at once. They can't climb the mountain. They can't see that mountain in front of them and just go climb it all in one day. We have to take incremental steps towards getting there and peel away the layers of the onion. And we don't know what we're going to see. And, when I start working with someone, just doing an initial lab analysis, and I see some things, maybe send them over to you. You order some more tests. We order a comprehensive stool analysis. We start seeing more, and those layers start getting peeled and peeled.
Right. And I often tell patients when we get some lab results back and we go over them and I give them a report and it's 12 or 15 pages long, it's so easy for them to get overwhelmed because they think, my body's broken. There are so many things wrong. Where do I start? What am I going to do? And I think we're both on the same page as far as telling them, let's pick 2, maybe 3 issues that are really fundamental and focus on those 2 or 3 things, those 2 or 3 problems. And for most people, it's usually blood sugar.
Yes.
That's a big one. And digestion, either not absorbing, not digesting well. And just focus on those 2 things, those 2 issues in your life. And a lot of times the other issues, the side issues, maybe secondary or tertiary problems, those will kind of self-correct because the body will seek homeostasis. Your body will do it. And it's getting those big issues under control first. So what do you find, like, what are some, I guess, success stories, or what are some really dramatic changes you've noticed with some of your clients? Like some really, maybe people you thought were really going to be tough to help, and you notice like huge changes.
Some of them really have been people that came and they would come with, the first thing that I do with anybody is they fill out a 22-page health, like it's a health history. It's a big inventory, and I do a lab analysis. So I do that, and they have a lot of things checked off, from inflammation, headaches, insomnia, weight gain, brain fog, you name it. So you look at them at first and they come to me and I'm like, wow, they've got a lot going on. But I know, and I'm trained to stop, pause, and look for the low-hanging fruit. And like you said, we start addressing some of that lower hanging fruit. Usually it's food. I start often with food. And I always say to people, this is what I think we're looking at, and this is the direction that we're going to be going in, but I really want you to pick the least stressful thing to start working on. So because stress, as we both know, stress can unravel all the good that we're doing. So So then they start working and they make some dietary changes, and all of a sudden they have more energy because they may have had some food sensitivities, some things inflaming. So some of my best success stories are people like, I have a young woman, she's around 30, and she came to me with PCOS, insulin resistance, Hashimoto's. She was on a statin, which was crazy to me that at her young age she was on a statin, overweight, mood issues, and just within 3 months, just three short months, really, I mean, just feeling like a completely different person. Her thyroid levels really balanced out. I did refer her because I network with a lot of different doctors and practitioners. So I was able to find her somebody to really help her with find the proper thyroid medication, but then the supplements, changing her diet, changing her lifestyle, having somebody by her side too, to speak with. I coach people, it's every other week. I ask for a 3-month commitment up front, 3 months. And if they continue working with me, that's great. And just a tremendous turnaround. People whose blood sugar, the blood sugar people, I think people who come to me with type 2 diabetes and high cholesterol, they don't realize that they really can turn that around with the diet and lifestyle. And I have seen that over and over and over again. And you too, like, because some of my clients are also patients of yours. So right. I have seen people just dramatically change their life, come off statins, come off metformin. If that's a goal, I'm not a doctor, so I can't tell anybody to do anyone, but I certainly can educate them and empower them with the knowledge to be able to reach their goals.
Right. What have you found to be the testing we've done that's been the most helpful for uncovering problems? That patient that's been to their primary care, they've been to a rheumatologist, they've been to an endocrinologist, and they're being told, yeah, all your lab work looks fine. Here's an antidepressant, here's an NSAID, here's a muscle relaxer, here's a sleep medication. So what tests are you seeing that we're ordering that are kind of flushing out those problems the best?
Okay, if we're going to start with just our regular lab work that somebody can go to LabCorp request and do, right. Full thyroid panel, absolutely. And you and I both know that that's not just TSH, that's free T3, free T4, reverse T3, and antibodies. Absolutely, hands down. Every time you and I have ordered that on somebody, I feel like we've uncovered a big root cause for them. So many people have thyroid issues, and we need to know too, if what's going on in that thyroid, number one, and then hemoglobin A1C and fasting insulin. And we have also started looking for leptin resistance. That's been game changer for people. Really looking at a C-reactive protein, I would say that's a big one too. So there's so many pearls that we are able to uncover just in those labs. And then from there, and I know you feel the same way, I think a comprehensive stool analysis should be part of everybody's annual physical. My hope and prayer is that medicine will head in that direction. But you and I being able to really look at someone's comprehensive stool analysis, that game changer, because 80%, if not more, of our immune system is found in the gut. So we need to know what's going on. Like, we can't just slap stuff, recommend supplements and just slap it, at someone's symptom. We really need to test rather than guess, because there have been things that have come back in those stool analysis that have shocked. I know they've shocked me and they've shocked you. Like, whoa, I did not see that there. So that's been really, really helpful. And then the Dutch test, the Dutch test is something you and I have started using in the past year. And that's the dried urine test for testing all of the hormones, the hormone metabolites, cortisol. It's incredible. It is the gold standard of adrenal and hormone testing that's out there. And again, being able to really understand what, if someone has estrogen dominance, even what kind of estrogen dominance do they have? What pathways is that going, or is the estrogen going down? And are they able to detoxify, all of that? I mean, it's just been incredible. That's a well spent investment on your health.
Yes. And I know when I first started getting into functional medicine and going to seminars back in the late 90s, with an early functional medicine doctor, one of the things he said is if you could only treat one system in the body, it should be the gut.
The gut.
That would be the gut, meaning the intestine, the digestive system. If you could only do one thing with a patient and help the most people, it would be the gut, the digestive system. So I would agree with you that stool analysis, it is an expensive test, but the amount of information you get, it's looking at, digestion, how you're breaking down carbs, proteins, fats. It's looking at inflammation, inflammatory markers. It's looking specifically for compounds that would show leaky gut. It's looking at your microbiome, right? It's looking at your profile of healthy to unhealthy bacteria in your digestive system. So it is an investment, but it's as you said, it's so often worth it to have done.
Absolutely. And we know that anybody with an autoimmune disease, and there are so many different autoimmune diseases, and it's really a rampant issue in our society, but the autoimmune disease is that autoimmune disease starts in the gut. So we know that there's something going on. There's some amount of gut permeability, and we need to know about that in order to really best be able to serve the people that we're working with, and all of the different medications that people have been on or are on, they do unfortunately compromise the gut health. I know that for myself, that was a huge, huge root cause of my disease and my issues, was being put on so many medications and being put on them very young, and repeat antibiotic use and overuse of NSAIDs and you name it, all of that, birth control. I mean, all of those things had affected my gut lining and opened my body up to different problems that, healing my gut has really turned around my health.
Yes. So you're an example of what you're telling your
I
client,
am.
because you've done it.
Yeah.
And in my case, often I've done it too. If I recommend a diet or a detox, I've probably done it.
Yes. So, we're guinea pigs.
Yeah. So what are you finding, the clients you've been seeing over the last couple of years, what are elements of success in those clients that you're seeing versus maybe clients who have a harder time making progress?
I think the biggest factor for someone in determining their success really is it comes from them, and it's their willingness and their readiness to be able to make the changes. Are they married to their lifestyle? They may want to reduce their insulin and turn around their GI issues and bring down inflammation in their body. But if they are married to a certain lifestyle or certain foods, and they're not willing or they're not ready, they're not going to see that success. I mean, it's really a mindset, and that's a lot of what I do dig into with my clients. I mean, we talk about mindset, and it's turning around your mindset and being open to implement different things, experiment. I like to use that language with people, is let's experiment. Let's just see how you feel. Let's give it 1 month of an experiment. And the clients who come in really, really ready, ready to make the investment in their health. And that investment, yes, it's monetary, but it's also your time and it's your desire. No, does it take more time to cook healthy whole foods? Absolutely. Yes, it's going to. I can't lie. I mean, if someone comes to me and says, I have absolutely no time and I eat out all the time, Yeah, that's, I mean, you're not going to reap the benefit of this. You're just not. So yeah, I mean, I can help. I meet people where they're at. Don't get me wrong. Everybody comes to me at a different I mean, I'll have people come to me like, I'll do everything. You name it. Tell me what test I need. If you tell me never to have a piece of pizza, I'll never have a piece of pizza again. But not everyone is there, and that's okay. That's completely okay. We start with what is the least stressful for somebody, and we work. But I will always be pushing someone and guiding them and educating. I shouldn't say pushing, that's the wrong word. I will be encouraging and inspiring and inviting someone along a path that will have them stepping outside of their comfort zone. But I'm leading you to a place that, because of my own knowledge and my own education, where I know that you're going to optimize your health, and that's your goal, right? I mean, ideally, people who come to us wanting to feel better, their goal is optimal health.
Right, right. One of my favorite quotes is actually from one of my kids. He said, and I love it, he said, if you want to do something, you will find the time. If you don't want to do something, you will find an excuse. And I think that's true.
Yeah.
We often could find the time to do things, but we do have other priorities that get in the way. Mm-hmm. So it seems like you're saying those clients that are willing to make this one of their top priorities are going to be the most successful.
Absolutely. Absolutely. Just being coachable. I think it's just being somebody who's coachable, who's open to the journey. And they're, nobody, I have not worked with anybody who has come into our coaching relationship who's been open and coachable and ready for change that has been unhappy, because they just feel so very good that in and of itself has sold them on what they're doing.
Right.
So their old lifestyle, they don't want to go back to it. They just don't. I mean, at the first, people will say, "Oh, I'm just so scared. I'm going to invest this time and the money, and I'm going to just quit because I've quit so many other things in my life, or other diets haven't worked. Why is this different?" And I just smile with full confidence and I say, you're not. You're just not. Just trust the process. Just trust the journey. This is different. I love food. I'm a foodie. I don't like being hungry. I don't like feeling deprived myself. So I'm not putting anyone on some super uber duper restrictive diet where they're starving all the time. So just, yeah.
All right. Well, I appreciate so much being able to interview you. And for my audience and for Jen's audience, it's Keeping It Real with Jen, mm-hmm. Functional medicine, health coaching. So you can look her up, and of course me at Chiropractic Health. Yep. And thank you so much for talking today.
Thank you. Take care. Bye-bye.
Bye.